Good morning, Patrick here from Complete Health. And I just wanted to talk about an experience that I've been having in the clinic again this week. So it's become a super common thing for me to start seeing clients who have seen a multitude of different practitioners that just don't feel like they can improve. A lot of the time, patients that come and see me, they've tried a lot of different things before they've come in. A lot of my patients may have tried stuff like stretching, exercise. They may have seen other therapists like other chiropractors, osteopaths, physios, GPs. A lot of the time they've been put on painkillers or medications by their doctor. And even some of them may have undergone basic surgeries, stuff like meniscus and arthroscopies, or even stuff like steroid injections, yet the problem still persists. And it's really interesting that in order to understand a problem very, very thoroughly, you have to be very, very thorough in the way that you actually bring the information in. And it's interesting, when you speak to stuff like a GP or people that have been to see their GP, there is no full, thorough history and examination. It's a case of having a 2-minute conversation with someone. The doctor's never really even touched the patient, and then a prescription is then made. Now, in my experience, this is not medicine's fault. They are given time constraints that are unrealistic to be able to serve that patient's actual needs. And if we actually spent a little bit more time understanding problems, we might get to the solution a lot quicker, and we may be able to actually solve those issues a lot easier. And actually, I had this interesting conversation with a patient this week who thought that chiropractic care is expensive. And actually, interestingly, in relativity speaking, if you look at how much a hip replacement surgery costs, it's about £12,000 versus chiropractic care. If you looked at that, you would probably be able to see a chiropractor about twice a week for about 5 years. Now, if you'd think that chiropractic care, in relativity terms speaking, is expensive to what health services are, then it's crazy. But interestingly, in order to be able to actually understand the problem, it takes time. It takes time, which is potentially why a lot of patients that come into me are frustrated, because no one's actually taken time to really properly, thoroughly examine and try and correct this problem. So if a problem's been going on for 10 years, it's not going to get fixed in 5 minutes. So a couple of times, patients do get a little bit frustrated with me because I don't treat people on the first visit. The first visit is always about me collecting all the information. We do full, thorough history and examination intake forms, e.g. we get someone to fill in a lot of their lifestyle choices, habits, injuries, problems, length of time it's been there, the aggravating factors. And then we'll go through a full history case discussion about what their targets are. How is this starting to affect their life? When do they notice it the most? What things would they like to be able to do that maybe they haven't done in the past? And any traumas that they might have had in the past. Because in order to understand the complexity of an injury, we have to understand the complexity of someone's lifestyle and the things that they've actually had to go through that has brought them to that place in the first place. And then we have to go through and do a full physical examination. That will include neurological tests, posture-based tests, muscle-based tests, ranges of motion. And so again, we have to go through a full physical exam, actually moving that patient, moving them around and seeing what triggers and aggravates that person, so we can then start to accurately work within the realms of what's going to help that person come back. Finally, I normally do clinical x-rays with a lot of patients who especially haven't improved before, but maybe are coming to me with neurological problems, long-term problems, people in their elder years who have not really been able to be helped elsewhere, or people that have gone and seen other therapists that cannot be helped. We have clinical x-ray on site, which gives us an advantage on being able to understand and diagnose. And there's been a lot of cases over the last couple of weeks that I've seen that therapists have probably been treating, but there has been a high risk because they've never had any further investigation. So if you're struggling with a problem, and it doesn't feel like anybody's really coming to any solutions with you, you maybe have to ask the question, was this properly and thoroughly examined? And if not, what needs to be done in order to be able to actually understand your problem so you can actually get over it, fix it, and have a solution once and for all? So maybe that's you. if you need any help or you need any advice, or maybe you just need us to get in touch and listen and see if we're the right fits for you, then obviously just get in touch with us and we will try to organise being able to help you understand your problem a little bit better. Patrick here from Complete Health, and hopefully I'll see you guys in the clinic very, very soon. Take care for now.